Some of our findings about how to think about governance and policy narratives in order to bridge the gap between climate and health. One of the key questions that we ask and that sparked our research is that despite the strong evidence that we have about the relationship between health and climate, there are little opportunities or limited opportunities for decision makers on the one hand to act on data and science alone. We understand there are other mechanisms that come into play. And health can also turn climate science into a human narrative. And this is something that we want to put forward. So we really, through this research, wanted to bring some perspective on how to bring those two approaches further. We also argue that the shift also implies giving much stronger attention to climate adaptation rather than mitigation, which has been a shift taking place only recently, and that this could be part of the discussion. So first, starting with governance and policy processes, the work that I've been doing from LIEPP highlights the fact that there is no direct relationship between science and action, and this is something that you are very familiar with. But I think the two critical points that we want to highlight as part of the work that we've been doing in public policy research is the fact that there is a very, very high level of fragmentation, both institutional and organizational, and climate and health policies tend to remain working in silo. And this is also one of the reasons why we work together. Anneliese comes more from the health approach, and I come more from the climate one, and we learned quite a lot from working with one another as well in research. Also, climate adaptation is a bit broad, so it addresses both the impacts of climate change on ecosystems and human communities, and a wide range of policy issues, including health and well-being, are addressed within this broad topic. But there also are a number of other topics that are addressed here, such as malnutrition, mental health, displacements, impacts on scarcity, with water management also being part of the focus, as well as the role of cities. So it is quite large aspect, and we need to unpack this. The second barrier that we identified in our work has to do with the poor visibility of health issues in climate policies, as well as limited policy capacities. In a sense, when we look at what the IPCC tells us about this broad range of work done on climate adaptation, there's only a small proportion of global tracked climate finance that has been targeted to adaptation. And within that, the largest share comes from public investment. And health being at best a very marginal dimension in those climate policy targets, tools and governance mechanisms, it means that there is limited resources for those actors that would wish to address those topics, to actually develop some policy resources, access it, as well as capacities. And this is particularly the case in low and medium income countries. And so we wanted to address that challenge with our research. So we thought we'd come up with some solutions that we've also saw as part of the work we've been doing, especially on these governance challenges. The first aspect would be to develop a more integrated governance mechanism. And here we can really draw on the experience that has been developed these past 4 to 5 years by another platform called IPBS, who has been able to bring together health on ecosystems together with the climate agenda, and they have been quite successful in building and developing quite a strong agenda for work, but also some action plans that help them take these issues forward. And so maybe we need to develop a more structured dialogue with the World Health Organization and the health community in order to bring those two agents further. The second solution that we've been working on is to promote multi-level governance, involving local communities. It is no secret to you, and maybe by walking in other areas of the Blue Zone, you've been able to identify the large amount of work that cities and resilient cities have been doing. And so there's a number of very interesting experiences that are being led by cities also in order to reach to climate finance, in order to support their efforts in bringing together health and climate. By bringing those two issues together, we also hope to develop some joint goals, priorities, but also an understanding of implications for modeling, appraisal, funding, and monitoring tools. And key aspect here would be to have some joint indicators in order to measure the linkages between health and climate. And of course, indicators are not an end in themselves, but on the other hand, it brings a perspective in terms of goals and targets to be reached, and as well as a regular conversation to be had with the different parties. And finally, we also suggest to reach out to the developments underway in the well-being and the post-growth research and practice communities. Some of the work we do here, well, not here, but at Sciences Po and as part of LIEPP with my colleague Éloi Laurent, for example, working in those topics to rethink how those two perspectives can help us think better between the relationship between health and climate, but also to rethink health and healthcare systems by including more issues of eco-social justice, climate impacts, and biodiversity loss.
What if health finally became a pillar of climate negotiation? Let me start with a story, not of data, but of narrative. The story of loss and damage. It didn't break through because of scientific modeling, but because of moral storytelling. The story of climate justice. Small island states carried it with powerful simplicity. Loss of lives, loss of culture, loss of identity. It was not the charts or projections that moved the world. It was the human voices describing the loss of norms, the loss of homes, memories, and meanings. You may remember the underwater cabinet meeting in the Maldives. A striking image of leaders laterally submerged, signing documents underwater to show what was at stake. That shift from carbon to the body, from economics to daily life, turned a technical negotiation file into a political cause. And after 30 years of talks, it led to the first loss and damage fund adopted at the COP27. Then came another narrative breakthrough, the COP of Health of Dubai. For the first time in history, COP28 had a health day. The Declaration of Climate and Health was signed by more than 140 countries, recognizing health as a pillar of climate action. It triggered joint commitments from the WHO, the World Bank, and the Green Climate Fund. The WHO Director General said that day, for the first time, health is at the heart of the COP agenda. That is what I call a performative narrative, a simple shift of framing from climate policy to health protection, mobilized new actors, new media priorities, and new alliances. It showed that a story can change the system. But this moment of visibility took place in a very specific context, the global stocktake, also adopted in COP28. A founding moment for climate diplomacy, the first global assessment of the Paris Agreement since 2015. It was meant to measure progress and guide the next decade of action. And indeed, the final text contains precise numerical targets, tripling renewables, doubling energy efficiency, beginning the coal phase down. But here comes the paradox. Health, omnipresent in speeches, is absent from the dashboard. The decision 1 CMA5 has no health indicators, no targets for system resilience, no link with climate finance. Health appears only once in the preamble. The right to a clean, healthy, and sustainable environment, the right to health. So that's powerful words, but with no operational weight. Hundreds of indicators for energy, emissions, and finance, known for human impacts. This reveals a systemic bias in global governance. What is not measured does not count. What does not count is not finance. So yes, health has won the battle of narrative, but not yet the battle of instrument, even though these instruments do exist, as this panel has just demonstrated. So the challenge now is not invention, but integration. There are still no dedicated lines in climate funds, no methodological follow-up in the UNFCCC, no integrated health climate dashboard. So how do we move from symbolic recognition to accountability? How do we give health the metrics, indicators, and shared responsibilities that make it actionable, not just aspirational? Thank you.